Hello, everybody. Welcome, everyone, to this safe space and Green Women. My name is Stephanie, and I am a member of the Green Women organization. I'm really happy to be able to take part here as a moderator. We have a beautiful space today, and we are happy everyone is here and Facebook and YouTube. So before begin, we'd like to remind you that these are safe space for all the people and the participants and characterized by active listen and mutual respect, please. Our space is create harmonious space and where our voices can be heard friendly and with empathy with everyone, especially for the participant today. So we have a ground rules, and I want to tell. The number one is listen respectfully. All everyone who speaks to express themselves without interruption. Please be silent during the presentation or conference. Um, Number two, do not interrupt during the presentation. During the main talk, please avoid interrupting with the comments or the questions. We're gonna be resolved after. The questions at the end, there will be designated time to ask questions, share opinions, or reflections. And number four is empathy with communication. If you wish to express an opinion or disagree, always do so respectfully. Avoid judgment and offensive comments, please. Let's look after the atmosphere. This space is for building, sharing, and learning as community, and to create this space for the women and growing. We would like to invite Dr. Sadaf Ahmed from Pakistan to join us. She's associate professor and a head of the Psychophysiology Research Lab, University of Karachi, President, Pakistan Society of Basic and Applied Neuroscience. Welcome to the program, Doctor. Present to you, please, yourself. Thank you so much for being here.
Thank you, Stephanie. And I shall share my screen so that I'll be continuing with presenting the. Okay, so it's just not, just let me do this again.
Yeah, we can see you.
Okay, thank you. Hello, everyone. Thank you, Stephanie, and thank you for this platform where we will be discussing about a topic we have discussed earlier in Small Talks, Big Impact by women in in science and also by UNESCO. It was a great experience when we talked about our research, and this platform is I think it's very helpful to just discuss these important topics and our researches to the audience that can always look into these problems and identify the translational aspects as well. My name is Sadaf Ahmed, and as you introduced me, I'm from Pakistan. I am affiliated with University of Karachi. Currently, I am in Canada for doing some postdoc and also some projects here and there in collaborations. So my presentation title is Two Brains Under Stress, where we can see that how the stress during pregnancy impact both mother and child. Um, this was the whole journey when it started and how it ended up in this talk currently, that when I was selected as the scientist, as a first position holder in Pakistan, as Pakistani, to win Asia Pacific Science Crown, and along with the Tehbina, and also the scientist from Sri Lanka. And I'm very much thankful to Green Women that you not only gave us the chance to just promote ourselves and our researches to the large number of audience, also from different domains of science, and also to the Organization for Women in Science for Developing World, that they are encouraging women and help us communicating, because I think as a neuroscientist it is very important to narrate our stories as women scientists, and your concept of celebrating the resilience of women in science is very much encouraged. So let's talk about what our project was. Most of you must not know, but most of you must know that Pakistan's maternal health challenge is a very diverse kind of challenge, where we have 155 maternal deaths per 100,000 live births every time, and then 36 newborn deaths per 1,000 live births. We also have less than 15% of pregnancies affected by approximately 15% of the pregnancies affected by gestational diabetes, and almost 3 to 8% of the pregnancies are affected by preeclampsia, which is known as high blood pressure during pregnancy. So these conditions actually are not only increasing the risk, or but also the severity of the maternal complications, like severe bleeding, seizures during pregnancy, organ damage in mother, and also even maternal death. It is also leading towards a very high potential risk that is happening in Pakistan a lot, is preterm birth. Babies born too early and face higher risk of infections, disabilities, and lifelong health challenges, including the brain health challenges. Neonatal mortality is also very high because of these challenges, and higher risk of stillbirth is there, newborn death, and serious complications are there. And also long-term child health problem, which is a whole vast range of development delays, learning difficulties, obesity, diabetes, and other chronic diseases as well in children, and it is very common here. So, maternal health actually matters, and a common link of preeclampsia and gestational diabetes is with the maternal stress. It is not only psychosocial stress that is being put up on the mother's brain because of the psychosocial pressures, social aspects, cultural aspects, but also due to nutritional deficiencies. Nutritional stress is there, physical stress is there because of the weight of the increased weight of the mother, the diet, the poor diet is there. There is also the physical effort and physical activity that is not in a very right direction. Physical stress is also there, then traumatic stress, then emotional stress. So there are different kind of stresses, but maternal stress can lead to preeclampsia and gestational diabetes. This picture is completely showing a very good picture that I made for you guys, especially that two conditions, but the one root cause, which is maternal stress can be the cause of the gestational diabetes, which is increased blood sugar level during pregnancy, a condition of high blood sugar that develop during pregnancy, and it contributes in high blood sugar during pregnancy, and after that always birth complications, higher risk of developing type 2 diabetes long term in their life, later in life. And how stress contributes to develop gestational diabetes is that because stress increases your stress hormone, which is cortisol, and these stress hormones promote insulin resistance. These stress hormones affect glucose metabolism and also elevate blood sugar levels. So this is a high risk situation. On the other hand, preeclampsia is also very common, which is a pregnancy related complication characterized by high blood pressure and organ dysfunction. And because cortisol is also responsible for increasing inflammatory responses, it impairs endothelial functions, which is blood vessels. Endothelial cells are there in the blood vessels, and alters placental blood flow to the fetus, and also raises blood pressure and vascular resistance, which increase blood pressure more. So outcome will be high blood pressure during pregnancy, protein excretion in the urine, swelling in overall body, and risk to mother and baby, and there are so many complications. So maternal stress leads to inflammation, number one. Number two, oxidative stress. Oxidative stress is actually the chemical stress to every cell of the mother's body, and it leads to the complication in the baby as well. Then hormonal imbalance overall during pregnancy, and placental dysfunction, which is actually the barrier and protection to the baby. So impact on mother and baby can be preterm birth, which we talked about, can be low birth weight, can be growth restriction, can be the future risk of a lot of metabolic and cardiovascular disorder, including high blood pressure and diabetes. So this was whole scenario, and we wanted to identify that how maternal stress impacts baby's brain and future health. So what we actually identified that maternal stress increases the stress hormone and it affects baby's brain. So beside the mother long term later in life challenges, the baby is also not only affected by certain health condition, but corally, if we can say that if it affect brain structure and wiring. Developmental delays result in developmental delays like impaired learning, memory, and attention. It increases risk of anxiety and depression in the babies. Affect behavior and emotional regulation in the child later in life. Higher risk of metabolic and cardiovascular diseases, and weaker stress response and stress regulation in the babies, which is very common nowadays. So our research approach was that we wanted to promote maternal well-being and healthy pregnancy and the better future. And for that we did, number one, psychosocial assessments. So psychosocial assessments were all done by measuring the stress of the mothers during pregnancy, during first trimester, during second trimester, during third trimester. And different scales were used, like perceived stress scales, like pregnancy related stress scales, and those stress scales measured the level of stress in the mother during different trimesters. Then we measured anxiety through various scales, like state rate anxiety inventory, and then Hamilton anxiety rating scale, and also depression in mothers preterm, if you can say, or postpartum depression. So Edinburgh postnatal depression scale and Beck depression inventory were used. There were many other inventories were also used, but our uh, approach was to first assess and screen the women for the stress, anxiety, and depression by their symptoms of behavioral alterations, right? And then we went for the physiological and biological measures, which is very unique because there were studies that was actually those were actually reporting the psychosocial assessments, and some were reporting the physiological or biochemical measures. But this was the combined approach, that we also screened them for the psychosocial assessment, and we went for these physiological and biological measures like stress hormones in the blood, like cortisol, inflammatory markers like C-reactive protein, like interleukin 6, interleukin 1, interleukin 10, etc. And vital parameters, we were actually measuring blood pressure, heart rate variability, blood sugar level, fasting, and also random blood sugar levels. And then oxidative stress markers, we measured glutathione, we measured selenium, we actually measured total antioxidant status. And along with that, we also went a step ahead for the genetic markers, like we worked on the oxytocin gene and also the melatonin gene, because oxytocin is the bonding hormone that also help to relax, and that also help mother to recover from the anxiety episodes or the stress episodes. And also the melatonin, which is also a kind of sleep hormone, but sleep is one of the major factor, that sleep deprivation and sleep lack of sleep or poor quality of sleep is also raising the all challenges of stress, anxiety, and depression in mothers. So basically we went for the two genetic marker studies as well. So after the assessment of psychosocial and then physiological and then also the biological markers, we went for the data integration and analysis, identify the key biological pathways where the link has been and the dots were connecting, and understood the link between the stress and the maternal health. And we also predicted some of the pregnancy outcomes, but we went also for the fetal outcomes as well. For example, we did ultrasound for the fetus and measured the head circumference and how it is actually directly affecting the fetus weight or its development. So we did all these studies, and this is our research journey, understanding how maternal stress shapes two lives. From 2018 to 2019, we started from exploring the link between stress and maternal physiology. We begin by assessing physiological and psychological stress in women using validated tools, and compare the different classes and socioeconomic classes, also rural women and the urban women, and how they are presented with the different levels of stresses, moderate, mild, or severe, in different trimesters as well. So we compare all these, we published all these, and we connected them and took a step forward. In 2021, we investigated glutathione, selenium, and different oxidative stresses in mothers, and we examined that these antioxidants are so vital for the protection, and how preeclampsia and gestational diabetes and other stress linked factors are actually reducing the oxidative markers and increasing the oxidative stress. So reduced glutathione level were significantly linked with pregnancy induced hypertension, and lower GSH, that is glutathione stimulating hormone, predicted adverse maternal and fetal outcomes, that is published and presented in our papers as well. So in 21 and 22, we continued it with like link that how women with higher stresses and lower antioxidants has greater risk of pregnancy induced hypertension, preeclampsia, preterm birth, and low birth weight. And biological stress in mothers may influence fetal development through the head circumference changes during the ultrasound of the fetus, the low birth weight, and how it is linked with the fetal development as well. And then 21 to 23, we actually linked it with the neurohormonal pathways like oxytocin and melatonin receptors. So oxytocin receptors, which are play key role in maternal bonding, that I mentioned, and melatonin receptor, that is essential for sleep, both actually were analyzed, measured during different trimesters, and during the after the development of gestational diabetes compared with the control group. And the key takeaway was that stress may disrupt important neurohormonal systems in pregnancy, and these genes, when disrupted, carry anxiety and depression, and probability of causing depression later in life in mothers and also in the children as well. So stress gene and gestational diabetes, our research showed that psychological symptoms are linked with the oxytocin receptor and melatonin receptor, and this may help identify that women in higher risk earlier in pregnancy, so they are integrating actually the whole symptoms, and early detection can prevent it, because all the story and all the research is useless when you are not linking it with the preventive role. So across all our studies, one message was very clear, that maternal stress is measurable, it is not unmeasurable. So normally the maternal clinics all over the world, and especially in Pakistan, the maternal clinics are also only looking for the overall women weight, and how we are actually focus on the physical markers and physiological markers, sometime related to hormones, the pregnancy hormones, and other than that, but we are not concerned about the psychological health of the mother. And when we are not looking at the psychological health of the mother in the maternal clinics, so it is actually causing a lot of physical health problems, and no one is actually focusing on the cause. They are actually measuring the physical health markers like glucose level, like blood pressure, but they are not aware of the fact that all these are happening because of the brain, which is disturbed, which is psychologically disturbed, or maybe because of the because of the deprived nutrition the mother is developing that oxidative stress or something like that. So maternal stress is measurable and it is biological and it can be detected early and it can be solved. So by understanding stress pathways, we can intervene very early in the pregnancy, during pregnancy, and we can protect two brains, mother's brain as well and the child brain as well. So from research to real impact, what we created, we went beyond science to improve lives and build healthier communities. While we were publishing all the data, generating scientific evidence, presenting in the conferences, publishing in the journal, and doing the hardcore science in labs as well, we also started doing the professional development. We were training the healthcare professionals like all the gynacs, the midwives, the nurses who were working in the maternal clinics, and also the NGOs, those were actually helping and building the hospitals. The hospitals, those were providing the maternal health services for free in Pakistan. So we were empowering the future researchers as well to encourage them to not only do the research in this line, but also how to actually identify these aspects. So community awareness session were also there. We did a lot of community sessions with mothers directly, both those women who were very educated and from the metropolitan cities and from the urban areas, but also the mothers from the rural areas who were not very aware of the fact, they were not educated enough, they were not resourceful, and translating the community awareness sessions in their language and then raising awareness about their own symptoms of stress during pregnancy and how they can identify their symptoms and how they can report to the doctors, how they can report to their healthcare provider, how they can report to their spouses as well, so that it can take care of their health in long term and their child health as well. We also did free mental health camps and also the physical health camp, providing free screenings and maternal health support to women in need. And also we also did linked all this to publish the free awareness article in the and did podcast to aware people as much as possible. Our mission was very simple, to transform the scientific findings into meaningful solutions. So what we did later, we actually designed evidence-based intervention for maternal stress, because our Pakistan is a very low resourceful country, and we know that we have not so much budget for the healthcare. We are not very resourceful at a very basic healthcare unit level, and people are pregnancy is a physiological uh, mechanism, and it is happening every now and then. Every hospital have this gynae ward, and every hospital has to provide services. So what low cost intervention we can tell these healthcare provider, and we can actually prove them that these interventions are low cost solution for mothers and babies for the better outcomes. So we published papers on nature exposure, that how nature, walk in nature and green environments reduces the stress, improve the mood and enhance well-being overall. So we published the not only published the papers, but we also did a lot of community awareness sessions on that clinical trials show that significant improvement in stress and pregnancy outcome. We also encourage physical activity, and we also did trials on physical activity, different types of yoga, meditation, mindfulness, also biofeedback, neurofeedback, and also other stress management techniques. So there were a lot of trials, a lot of research, but those all were the solution based. I'm very proud of my team, and I'm very proud that we actually established the evidence based intervention for the solution for maternal stress, because these are all low cost, scalable, and empowering mothers in a very cheap way. uh, so this was all my project, and this is how we did things step by step, from identifying the problem first, that how it was a problem for Pakistani population, how it is impacting mothers, how it was impacting the children, how it is actually impacting long term lives of the mother and children. And as a neuroscientist, we were more concerned about the brain health. So yes, mental health issues were there, but no one is talking about the cause from where it is generating. So pregnant women should be cared for, should be in very enhanced state of well-being rather than being stressed. And then identify the molecular and biological causes and what is happening inside the body, what biomarkers are actually disrupting, and how we can correct them by these low cost interventions. So this was all my journey and in this particular project. And there were a lot of people who collaborated. We did a lot of collaboration with the local hospitals, we did a lot of collaboration with local NGOs, we did a lot of collaborations with people who actually supported our research, including from the Government of Pakistan Higher Education Commission, who actually funded us twice for these projects. And then from international perspective, we collaborated with Dana Foundation for the community awareness of the mother and child brain. And then we collaborated with International Brain Research Organization, and there were other universities as well. So this was the whole project. But as I was today, I am actually invited and encouraged about talking about the whole concept is there, but as a woman in science, what challenges I faced, um, being in Pakistan, being a women scientist, and being from a country which is under resourced. And you can say that we also have certain cultural challenges as well. So the second part of my presentation, less than 10% of the women are in STEM in Pakistan. We are still debating whether these are gender stereotypes or choice or cultural thing in a country where only 13% of the girls are still in school by the time they reach the ninth grade. And it is not surprising that families do not focus on their education and career, and these are the correct figures. So women doctors don't and some who actually reach to the upper level of their career, like women doctors, they don't choose to leave work, they are forced out of their careers. Almost 85,000 female doctors not pursuing career average after getting medical degrees in Pakistan. So these are the cultural thing, and people are not pursuing STEM, and women are not pursuing STEM. So what were the barriers, or what are the barriers? Barriers to women's participation in science and education, particularly in Pakistan, or you can say the South Asia. Gender roles and expectations are very, very clear and very, very now we do debates a lot of time, we do the debates in the panels and the conferences, but still on the ground level the gender roles and expectations are the more you can say it pressure the women most. Limited access to education because of certain cultural aspects, certain religious aspect, and also the resources, unfair distribution of the resources as well. Societal norms and stereotypes are there. Religious conservatism is the biggest issue. Arranged marriages and early parenthood is one of the things that women leave their careers and do not pursue it. Harassment and safety concerns are there. Women are stepping out of their comfort zone, but they are actually being again sidelined because of these issues. Lack of female role models, again because if people are not coming to the highest level of the in the boardrooms, in the leadership, so obviously there is a lack of female role models, a significant lack of female role models. Then economic constraints are there, and lack of supportive policies in every aspect of the education, even our economics, our government level, our universities, our every institution has lack of supportive policies regarding women. So what I believe that we need more empowerment narratives, we need more communication narratives, we collaboration narratives is very much supportive. I appreciate green women that every step counts and every drop counts. So if we are arranging such kind of conferences, if we are exchanging such narratives, if we are telling our stories, if we are actually telling our story of resilience, leadership, or innovation, So it's actually inspiring some people throughout the world, around the world, globally or locally, because now technology can help us. To be true, much more needs to be done in Pakistan still, because it ranks very low in the global gender index, and uprooting the gender status quo will require more disruption. You can see that there are a lot of girls in the convocation sitting here. This is the convocation from the biggest university, public sector university in Pakistan, but still we are fighting for the basics, because a lot of women do not get these opportunities, so even completing their schools. So the if the women are coming to the colleges and then university, so these are less than 1%. This is my story also. When I was a kid or a child, I have been labeled, and this is one of the biggest challenges we have with our childhood as a part of such society where these challenges are there. We have been labeled, for example, I have been labeled too quiet, always sad, so lost, shy, angry bird. And later on, the when we go into being assertive, or you can say a fighter, to go for the education, to go for the opportunities, we have been labeled as tough, too ambitious, bookworm, boring, too raw, timetable, workaholic. And then when you become boss, so you have been labeled by all these labels. So this is what a women in leadership, women in science, women who has determination has gone through every time. And I think many women can relate to this. But to change all these negative words into the positive one, this is Pakistan, and this is these are our children, and we want to do a lot for them. Every time we see them, we want to encourage them. These all girls deserve the same opportunity. These all girls have the potential. They just want to be nourished and being presented with the right set of opportunities every time. So, like these girls, these are from rural areas, they are becoming midwives. And I was the part of the program where from Pakistan, from every corner of the Pakistan villages, these girls are coming, and then they are getting trained as midwives and nurses. So we are so proud of them, and we have been part of these projects. So I am very much positive that we are bringing the change. These are our people in pain, because personally I was also doing my PhD in the pain. So these were the faces that actually inspired me to help everyone, because these are our population. Lack of resources were there. These were my PhD times when we were going to the public sector hospitals, and all the less resourceful, less updated, but the instruments were there, and we were actually measuring all the electrophysiology and psychophysiology studies we were doing. Screening, assessment, and treatment. We measured the biomarkers, heart rate variability, temperature, skin conductance, respiratory rate, brain waves, and muscle tension. There is a word that Harvard University and other business models, business schools actually teach people a word which is known as jugaad. It is from India and Pakistan, that we are working from available resources, establishing tool, and innovation is at peak. If you can see that this is a motorbike, and it is developed into a whole rickshaw, which we say rickshaw, and this is actually an innovation. So jugaad innovation was there, that the instruments were very, very, very expensive, and we were not able to actually import them. So we actually collaborated with a lot of biomedical engineers, locally students, and then we developed electrophysiology instrument by ourselves, because we didn't have the resources. So this was first instrument in my lab that we actually designed, and we actually established by ourselves, and this was the data. It was actually doing the same work that we were expecting from a big instrument, but we were not able to purchase that. One of the achievement that we have done is Sadaf stress scale, which is my name. Sadaf stress scale is one of the tool that measures stress, specifically for Pakistani population, because there are so many inventories, there are so many scales that are accepted globally, but there was something missing, because Pakistan has different set of stresses as well. So in 2012 I started gathering the information that what different kind of stresses and what different kind of symptoms we are, or what different kind of stressors there are in Pakistan. And after doing validity and reliability study, we were able to publish this in 2014 Sadaf stress scale, and then it is being revised in 2019, and 2025 it is published again as a third version of Sadaf stress scale. So this is one of the thing that we did for Pakistani population. These are all these studies that we published in different journals, and did our part as a scientist. But the biggest thing is that to link it with the community, the stress clinics, these were completely and totally free. You can see me here, and I'm also sitting here. So initiative stress clinic in tertiary care hospitals for free to screen people, and also these were all the volunteers who were actually working. So we used to train them, and then we provided these free stress evaluation clinics in all the hospitals. Then there was a very sad moment in 2014. Pakistani school was actually attacked by Taliban's, and we lost our uh, 148 kids in the school. It was very unfortunate, and at that time we identified that there were no psychosocial centers and trauma centers there in the northern area. So we went there, we collaborated, we actually I wrote all these three manuals, which is like how to build a psychosocial center, particularly the standard operating procedure, because trauma was everywhere, and psychosocial mental health guidelines for the mothers and fathers and teachers and caregivers as well. So we did our part, we tried to did our part. It was traumatic, but it was a window where we knew that we have to establish our own guidelines for future as well, and for the survivors as well. At that time, I was also very concerned that trauma is a very big thing, and how these kids survive trauma. But there is not only happening something happening that we can do by screening and question answer session. There is something happening in their bodies as well. But I think at that time it was very early, or too early for that particular scenario, because it was a very different part of the Pakistan. So we were not able to communicate that yes, it is causing changes physiologically. So what happened, after 2 years, one of the child who survived that attack lost his life, because trauma, physically he was recovered, but mentally he was not recovered, and trauma hits back, and he lost his life. And this is what psychophysiology has done to psychophysiology is all about. And I think psychophysiology was a new word at that time. So I was the one who actually introduced psychophysiology. And when we were starting to initiate the psychophysiology, people were not very aware of that. In 2014, dedicated to these children, we wrote our first book, Psychophysiology of Stress. And it was based on different types of stresses, how it actually changes your body. So now people started recognizing psychophysiology. Then we linked it with the masses as well, like through press conferences, you can see, through panel discussions. We also involved certain drama artists and actors to actually perform the theater plays on mental health, on brain health, and to communicate our idea to the general public. So it was very successful, and we did a lot of plays, a lot of theater plays, a lot of drama, a lot of song based play, dance based plays. And also we did stress evaluation stalls freely in 32 different universities around the whole province. So these were all the efforts. Then a step towards the maternal stress was also that psychophysiology sessions made mandatory for gynae and obs. So the largest conference of gynae and obs in country, annually it happened, and whenever it being organized since last 15 years, we are part of that. We not only deliver keynote talks or lectures on the mental health of mother child, how the impact of infertility is there, how mental health should be treated. We also do these roundtable session with the gynecologist, and we trained almost every time that conference is attended by more than 10,000 gynecologists, and we always interact with them and did pre-conference workshops as well on the maternal stress and their impact. So sensitizing the right set of people for the maternal stress issues. Published and presented, these are the abstract book from all over the world, from Malaysia, from India, from Nepal, from California, everywhere. And these are the abstracts, and then these are also some newses and podcast and everything. More than 100,000 of the public uh, has been reached via our awareness sessions. If we talked about numbers, 450 sessions overall we did to Pakistan. In Pakistan, presented and trained in scientific session, more than 7,500 people actually presented and get trained in our events that we organized. Almost 55 conferences and seminars we organized, 50 manuals and booklets, and you can say the public awareness booklets we published, and more than 200 scientific publication and presentations done by our trainers as well. So the main vision of service to me is always advocacy, mentoring, and research. And I was the core leader, so I actually tried to engage like-minded people, make the leadership going, make the core group, invoke curiosity, not only in undergraduate but also the um, like-minded people. I always led through hard work for well-being. The basic thought is always to enhance the well-being of every common man and everyone around, and changing the perspective to look at the scenario. Future prospect, always look for the opportunities that make us closer to the goal. I encourage everyone in the healthcare field, because I'm from healthcare, to reduce human suffering and building better brains by involving them in this journey and lead them to the best of their potentials, and also to learn from the world and collaborate for the best outcomes. These were the nurses as well, and this was one of my favorite moment when I was actually doing the stress management session with the nurses, because they were actually doing a great job, doing overtimes, doing night shifts. So this was a great session, and I was actually responsible to make them laugh. It was very good. These were the sessions, people were doing suicide at the time of COVID, and these were the kind of session that I have been doing to just let them aware of their symptoms and mental health. These were also some corporate sector where I went to talk about how workplace well-being and the mental health is very important. These are the international things that I always did. And like this is something I talked about around the globe. And these are some of the very enriching experiences, because we were actually doing a lot of research on nature, exposure to nature. So around the world, from China to Chitral in Pakistan to Switzerland to uh, Caribbean islands, these were all the places where we studied the impact of nature, and then we came back to implement this in Pakistan as well. We also did mental wellness free clinics all over Karachi and in 7 different hospitals. This was how free clinics were done, and this is the biofeedback session we were and neurofeedback session we were doing in these free clinics. This was actually UNESCO, and UNESCO actually selected me for a fellowship in China, and this was the amazing training at that particular course. I was also invited at Washington. and selected as a four women in neuroscience around the globe from a under-resourced country to do a lot. And I was invited to present decade of work in Washington in front of almost 30,000 neuroscientists from all over the world. I was also highlighted in World and Women in Neuroscience, and I am a part of their now executive and collaboration committee. So we can always collaborate. You can always write to me, and we can do a lot to promote women in science and women in neuroscience specifically. This is the energy this picture can speaks up. This is how I am encouraging people, and this is at the end of one course we did in 2018. It is happening from then. It is happening every year. The conference happening every year, and this is the youth need to be if they are there in their undergraduate, they need to be motivated, they need to see their role models, they need to be on track, and for that we need such healthy mind and bodies provided with a right set of opportunities. This is the biggest achievement. Last year in November, I have been awarded as the Science Educator Award by Allen Institute and Society for Neuroscience in San Diego, USA. And I think awards always matter when it help you to get a positive feedback so that you can work more for the people. And I think it is very encouraging in that way. These were all the collaborations we did around the world. The main thing that I actually enjoy is this is one picture from a science exhibition that was arranged for the schools in Lahore, Pakistan. And you can see this little girl who was very fascinated by the brain and the skull. She was actually visiting the neuroscience stall we put to encourage a student for their career and how they look for their future. And you can see our volunteers are there to tell them basics about brain and the vertebra you can see here. And this picture actually inspired me that this is what keep us motivated and keep us doing. No award can do that. This child is interested in so much passion in her eyes is actually what keep us motivated. So my message is always that some women are always building empires, but others are always learning from them. We can be both. We can be building empires, we can build pathway, we can carve pathway for all the women who are actually entering their careers or who are actually planning their lives. But we can always learn by our mistakes and also our potential to learn more. So we have to be both a builder and a learner, because if we want to strive, if we want to be an inspiration, we have to be better and better. So for that we have to build network, and we have to be like this, like I'm sharing my story. So thank you so much for this, and you can write to me if you want to collaborate, if you want to know something. You can always write to me on these email addresses, and I will be there, and I am very happy to take questions if you have any. Thank you.
Thank you, Dr. Saf. I'm really surprised and I'm really impressed because this is a wonderful presentation. And actually, personally, I admire you. You great job and what you for the women's because it's not easy
Thank
for
you.
us. For be honest, it's not easy for us to develop and be a women successful. And this world is everyone wants to immediately, and I think so that's really important because your work is not just only highlight the issues facing young people today, actually is the hope for the future women they want to be a pregnant, and is the hope to thinking about the be a mother in the future. I think this is gonna be really good this work, and I am really grateful you are here, you be here, because I want to share this project and your work and this part from Latin America. And I want to share for another women that's gonna happen, because for be honest, we fighting all the time in the science women to show our articles, to show what do you do, to show our a passion and our works, and we don't have the space, right? It's just try to find the space to show and fight and and to do this. And I think so, as well as giving hope to the moment that will begin successful mom, they can also learn to be a mindful moms, to be more conscious of what they do. Because sometimes I think seeing we want to be successful, we want to be a mom, but we continue and then stress and pregnant and work. And I think so that's the you work demonstrate and give you us like a base to say, okay, we can do a space to be a successful, be a mom, be a more conscious, be take a space during the pregnant and everything. You know, that's really, really, really nice. And thank you so much, Dr. Sadaf. And we have five questions. Um, the number one is, you mentioned that the maternal stress is not just an emotional experience, but a biological reality shared by two brains. What do you think prevents this view from being an integral part of antenatal care to most healthcare systems today?
Uh, Good question. I think the biggest reason is that healthcare has traditionally set to separate physical health from mental health. And during pregnancy, we routinely measure blood pressure, blood glucose, fetal growth, because these are visible and measurable. And stress, on the other hand, how often being considered subjective or a simple part of the pregnancy, or it is a routine thing maybe. So, but neuroscience, as a neuroscientist, this has changed. We actually have a very different understanding. We know that the chronic stress influences the inflammatory pathways, hormonal regulation, oxidative stress, and even placental function. So these biological processes are real. These are not just emotions. These are real. These are happening in the body, and these are physiologically changing your body. The challenge is translating this scientific knowledge into clinical practice, and we need very simple, validated, and culturally appropriate screening tools, like we develop Sadaf stress scale that can be integrated into routine antenatal care. My vision is not to replace existing care, but to complement it with identifying stress at the correct time, early, before biological dysfunction and pregnancy complication even begin. So it is very important. I hope I answered it.
Yeah, and I agree with this, because I think so. Wherever we want, you are from Pakistan, I am from Bolivia, and I live in Colombia. But I can note the similar issues we have,
Yes.
and actually, the stress is just one word. The stress is there, and we have different
Yes.
topics, but we have in the same issue. So for my second questions is, give me one second. Your work brings together neuroscience, endocrinology, psychology, and obstetric. What have been the biggest challenge in taking this project forward and ensuring that the issue of stress is addressed from multidisciplinary perspective?
I think one of the biggest challenges has been bringing together different aspects from different fields, experts from different fields who often speak different scientific languages. So they are expert of their field, and they always use different vocabulary. They have different understanding, and they have different scientific perspective. As a neuroscientist, I think that neural circuits and stress pathways, as an OBS, someone is actually corely focusing on pregnancy outcome, and endocrinologist might only focusing on the hormones, while a psychologist purely evaluate emotions and behavior. Yet pregnancy does not separate all these systems that are all interconnected. So building collaboration required very mutual respect and conditions like we put on table the discussions, we have to have continued dialogue with one another. And I was fortunate enough that one of my mentor is one of the most popular male gynecologist in Pakistan. In a country like Pakistan, being a male gynecologist is a challenge as well, but he is one of my mentor and he worked a lot. He's a true feminist as well. And I was fortunate enough to work with his under his advisorship, and also to work with outstanding physician scientists as well. So multidisciplinary teams were there who shared the same goal, because we were actually talking about the improving maternal mental health. It took time, but another challenge also has been conducting high quality research in a very low resource setting. So whether people agreed, whether we were all very keen to do the research and produce the outcome, but we were all under resourced. So resource limiting setting was the second challenge, because some people have the hospital, some people had the clinics, some people had the biggest OPD, a lot of patients were coming, but infrastructure was not there, the financial limitations were there, and we continued to hit against the wall because the scientific question was too important to ignore. So we collaborated and we kept going.
Yeah, I can see. Yeah, and actually, we can see everyone is connected because this. I think so. That's the part of the natural cycle in the human. Like the brain is connected, the organ is connected with the heart and the blood and everything, and we have a little perfect function. And sometimes when we don't explore this, it's difficult because we can understand how is functionally our body, and we can think the breathe is really important to do like breathe and works, and this is gonna help with the like much better in the brain when you use the breathe and work and everything. But this really amazing project, and I have more question for you. Like 1 second, and I will ask you. Uh, as well as begin a science, and you write from a very human perspective. How do you manage to balance the rigor of science and evidence with the need to convey empathy and a sense of clemency to the women and the families going through this experience?
I think science is all about evidence, but empathy what gives us the meaning of the evidence. So I never want women to feel that they are simply the data points in a research paper. Behind every blood sample, behind every question narrated in their own language, or a biomarker, there is always a person with hopes, fears, and responsibilities. And you have to connect to them. And empathy is the core thing. At the same time, empathy should never replace the scientific rigor. I agree. But good science always require objective methods, reproducible results, and critical thinking. But my goal has always been to be human first and then the scientist. So when you combine both to communicate the evidence in a way that families, and especially the females we were working for, can understand while maintaining the highest scientific standards. And mothers are very, very uh, easy. I cannot say easy, but they are very approachable and easy to connect in a way that we are speaking their same language, because research should not only um, mm, advance knowledge, but it should improve life. And when you talk about stress, which is very personal, so it's always connecting people. So might be there was also the topic that I was working for, because if I have been working for the placenta thickness, or I was working for something like that is not connected. But when I was talking about stress to them, and I was initiating a project, and I was so it was very uh, connecting since beginning. And I also noticed that even after their pregnancy, successful pregnancies, they were actually kept connecting to me. They actually kept connecting to our team, and they recognize us, and they were actually very concerned about their mental health, their child mental health, and they keep coming back in the hospital, that particular clinic. They know that we were there, and this clinic is there for free for their help. They keep coming back, and always after that also help us to identify that yes, there is a very much great improvement in their life because they are self-aware now. So might be the topic, the psychological aspect is there, that they think we are more concerned about them rather than science. So psychology is I think one of the signs that connect people, I think.
Yeah, for sure. Actually, talking about psychology, I actually it's really important to know about this because now I think so the population in the world they thinking just only in be more fast with the stuff, be more quickly with the challenge, but we don't thinking about the